For many women, the first sign of pregnancy is a missed period. However, pregnancy symptoms can start much earlier, sometimes even before your expected period. These early signs can be subtle, and many women mistake them for normal premenstrual symptoms. If you're wondering whether you could be pregnant, paying attention to these early clues might give you an answer before a pregnancy test does. In this video, we'll explore some early pregnancy signs that are often overlooked. Let's get started. Implantation bleeding and cramping. One of the first signs of pregnancy is implantation bleeding, which occurs when a fertilized egg attaches to the uterus lining. This typically happens 6 to 12 days after ovulation, just before your expected period. Now, this bleeding is usually lighter and shorter than a regular period, and it may appear as light pink or brown spotting rather than a heavy flow. Some women experience mild cramping, which can feel similar to period cramps but is usually less intense. Since this happens close to your expected period date, many women assume it's just an early or light period and don't recognize it as a pregnancy symptom. Changes in breast sensitivity. Hormonal changes in early pregnancy can cause breast tenderness, swelling, or sensitivity as early as 1 to 2 weeks after conception. Your breasts may feel fuller or heavier. The nipples may become darker or more sensitive. Some women notice that their veins on the breasts appear more prominent. These symptoms can be similar to those experienced before a period, which is why they are often overlooked. However, if your breast discomfort feels more intense or different than usual, it could be an early pregnancy sign. Unusual fatigue. Feeling extremely tired for no apparent reason could be an early sign of pregnancy. Increased levels of progesterone in early pregnancy can cause fatigue even before you miss your period. You may feel more exhausted than usual even after a full night's sleep. Simple activities that didn't tire you before might feel draining. Some women experience frequent yawning or difficulty staying awake during the day. If you find yourself needing naps or struggling with low energy, it could be due to the early changes in your body preparing for pregnancy. Changes in appetite and food aversions. One of the more unusual signs of early pregnancy is sudden changes in appetite or food preferences. You might crave foods you don't normally eat. Certain smells or foods may suddenly make you feel nauseous. You could have a strange metallic taste in your mouth even when not eating. These symptoms are due to hormonal changes and can occur as early as 2 weeks after conception. Some women dismiss them as normal fluctuations in appetite, but they could be early indicators of pregnancy. Increased frequency of urination. Needing to use the bathroom more frequently is another overlooked early pregnancy symptom. Rising levels of the hormone HCG, human chorionic gonadotropin, cause increased blood flow to the kidneys, making you urinate more often. This symptom can begin even before a missed period and may continue throughout pregnancy. If you find yourself waking up at night to urinate or needing to go more often than usual, it could be an early sign. Mood swings and emotional changes. Hormonal changes can lead to unexpected mood swings, similar to premenstrual symptoms, but sometimes more intense. You may feel more emotional or cry over small things. Anxiety or irritability may increase without a clear reason. Some women feel an unusual sense of calm or happiness. These mood changes are caused by the rapid increase in pregnancy hormones and may be one of the first signs that something is different. Mild nausea or dizziness. Although morning sickness is usually associated with later pregnancy, mild nausea or dizziness can start earlier than most people expect. You might feel queasy at certain times of the day. Dizziness or lightheadedness can occur due to changes in blood pressure and hormone levels. Some women experience nausea after eating foods they used to enjoy. If you notice sudden changes in how your stomach reacts to food or movement, it could be an early pregnancy indicator. Slight body temperature increase. A less commonly recognized early sign of pregnancy is a slight increase in body temperature, also known as basal body temperature. If you've been tracking your temperature, you may notice it remains elevated beyond your usual cycle. This rise is due to hormonal changes that help maintain pregnancy. Many women tracking their cycles for conception use this as an early sign that implantation may have occurred. Recognizing early pregnancy symptoms can be tricky because they often resemble premenstrual signs. However, small changes in your body, such as implantation bleeding, increased fatigue, frequent urination, or sudden food aversions, could be early clues that you're pregnant. If you suspect you might be pregnant, taking a home pregnancy test after a missed period is the best way to confirm. If symptoms persist and you're unsure, consulting with a doctor can provide clarity. Did any of these signs surprise you? Let us know in the comments. And don't forget to subscribe for more insights on pregnancy and women's health. See you in the next video.
we do together. This is a time we'll savor forever, all the little things we say.